This presentation is part 2 of Return to Play, addressing the focus question, how is injury rehabilitation managed? The presentation will address psychological readiness, specific warm-up and cool-down, return to play policies and procedures, and ethical considerations, including pressure to participate and use of painkillers. Psychological readiness. An injury can impact on an athlete's psychological well-being. An athlete may feel that they may lose fitness or their spot in a team if they do not participate in training sessions. This may lead to anxiety or depression, which in turn can affect their approach to rehabilitation. Depending on the type of injury, the trauma from sustaining the injury may affect an athlete's ability to participate. For example, if a rugby league player injures their knee very seriously, the memories of this accident may prevent them from wanting to return to the sport. Some players may also see the long rehabilitation process ahead as a negative, and this may lead to them losing confidence. When rehabilitating the physical injury, it is therefore important to rehabilitate the athlete's mental capability and make sure that they are psychologically ready to restart training and competition. This ensures that any negative thoughts do not contribute to further injury. Now, you also need to consider that the longer a player is away from their sport, the more likely, or the less confident, I should say, that the athlete will be on their return. So it's extremely important that during the rehabilitation period that the athlete and coaching staff may want to seek guidance from a sports psychologist to work with them to identify specific aspects of the sport that the athlete has lost confidence in. So it might be coming back from injury, a groin injury, for example, for a soccer player. This would affect their kicking ability. So a sports psychologist may be able to help them to focus on kicking and get that confidence back again. So confidence could be regained again through performance simulations, so training and drills and testing and other assessments that might evaluate or test strength or flexibility during the rehabilitation phase. Sometimes the evidence of the athlete's performance can actually ensure that their confidence is fostered as well. So if an athlete can see or can understands that their speed is improving with rehabilitation because they've done some speed tests, then that's going to improve their confidence and make it more likely that they'll return more successfully. Now, taping can also assist with psychological readiness. Taping a joint provides support, but it can also just help the joint maintain its normal functioning. Now, one of the concepts that is important to understand is proprioception. Now, proprioception really is the sense of knowing where the body part is in space. It's a difficult concept to grasp until it's lost, and through injury it can be lost. A lot of proprioception occurs subconsciously, so your proprioception capabilities can be impaired when a joint, for example, is injured, so a ligament sprain to the ankle. The proprioception, or the awareness of the capabilities and movement of that joint. So when proprioception of the joint is lost after a sprain, an unstable sensation of the joint may be experienced. So the joint may give way and lose its normal function because that proprioception is not there. So poor balance can result. So that can also lead to a lack of confidence and a lack of psychological readiness, but taping could assist with that. Specific warm-up procedures. When returning to play after an injury, an athlete's routine needs to include warm-up stretches and drills that are specific to the injured area. ensuring muscles are warm, stretched, and ready for physical activity is important in preventing further damage. For example, a bowler in cricket who has had a shoulder injury may need to include circular rotational movements or circumduction at the shoulder joint to ensure the muscles are ready and that the joint is prepared for the bowling action. Other examples, a soccer player returning from a hamstring injury or a groin injury would need to do a range of dynamic movements such as leg swings to ensure that the hamstring is ready and flexible enough to kick the ball, and this prepares them for the game. So specific warm-up procedures should be maybe a little bit longer if you're coming back from injury, just to ensure that the muscle or the injured site is ready. It should be specific, so it should target the injured area. It may require some extra time and care. It might require some extra stretching. It might require some massage. It might require some extra jogging. And this just ensures more flexibility to the area, more blood flow. It increases the temperature of the athlete so that the athlete is warmer, which always assists the injured side or the previously injured site. And it also prepares the athlete mentally. The longer that an athlete warms up, generally speaking, they will be more ready to go out there and perform at their best. Now, the importance of specific warm-up procedures when returning to play. A sprinter, for example, returning from a hamstring injury may include some jogging, some dynamic stretching to both the quadriceps and the hamstrings. This would ensure that the muscles are extended in a safe environment and beyond what will be demanded in the competition. So the idea is that the athlete stretches their muscles to a point where they know they're going to be stretched to those similar levels in the actual competition. Elasticity, full range of motion, increased blood flow and temperature are all part of this warm-up procedure, and that is going to assist the athlete to start playing or competing at the highest level, and the athlete's more likely to be physically and psychologically ready. Return to play policies and procedures. Sports clubs have a responsibility to ensure that policies and procedures are in place for players returning from an injury. Clubs have a duty of care to ensure athletes are fit to return to training and competition when they are injury-free, not before their injury is healed. Most sports have return to play policies in some shape or form. These policies are created by coaches, sports administrators, and sports medicine practitioners. They vary with sports. Some sports, particularly contact sports, have very detailed return to play policies. Some sports, which are maybe perhaps involve less contact, may have less rigorous return to play policies. They are often determined by governing bodies or individual sporting clubs, and policies depend on the nature and severity of the injury. A priority must be given to player welfare, with medical advice guiding decisions and policy. Now, the NRL has a very detailed return to play policy. Now, this policy requires each player to get medical clearance for a range of conditions, including heart conditions, hypertension, broken bones, fractures, soft tissue injuries, concussion, neck injuries. The list goes on. So basically, the NRL's philosophy is to never allow a player to return to the field of play if there is any doubt of further injury. The accredited National Rugby League sports trainer will have the last say on player welfare. But one of the most